Hello students, welcome to Pharma Syndrome YouTube channel. Today our discussion is on muscarinic receptors. So how many types of muscarinic receptors? What is their location? What is their function? So here the muscarinic receptors are comes under parasympathetic nervous system. So in parasympathetic nervous system, the ligand molecule is acetylcholine. This acetylcholine interacts with muscarinic receptors as well as nicotinic receptors. Here our discussion is on the muscarinic receptors. There is a total 5 types of muscarinic receptors are there, and all these 5 types are belongs to G protein coupled receptors. All these 5 types are belongs to the G protein coupled receptors. So here there is a term called as signal transduction. So regarding what is signal transduction, you have to know what is the importance of signal transduction. Please go through the receptor pharmacology of G protein coupled receptors in our previous videos. Okay, here our main intention is types of receptors regarding muscarinic receptors, their location as well as their function. Here the first one is M1, type 1 muscarinic receptors. Regarding the location, present in central nervous system as well as gastric glands. And regarding the signal transduction, there is active G protein is G alpha Q. There is active G protein G alpha Q, and the secondary messengers are involved are diacylglycerol as well as IP3. IP3 inositol triphosphate, DAG means diacylglycerol. Regarding the functions of the M1 receptor, in the CNS, the acetylcholine through M1 receptors involving in the memory as well as learning. As you know, decreased acetylcholine in the brain, CNS, leads to Alzheimer's disease. That is loss of memory. That's why when acetylcholine function is decreased in the brain, it leads to Alzheimer's disease. And in the gastric glands, the role of M1 receptors with help of acetylcholine acid production. That's why M1 receptor blockers are used in ulcer treatment as a anti-ulcer drugs. This is regarding the M1 receptors. And next, M2, type 2 muscarinic receptors location is heart, cardiac muscle. And the active G protein is G alpha I or not. I means inhibition, which is opposite to the stimulation. Here, there is a decreased adenyl cyclase action as well as decreased cyclic AMP action. When M2 receptors on myocardium is stimulated with help of acetylcholine neurotransmitter, what is happening there? There is a inactive G protein activated G alpha I or not. Means I means inhibition. Because of that, there is a decreased adenyl cyclase, decreased cyclic AMP, and especially when cyclic AMP concentration reduced on the muscle, especially cardiac muscle, there is no muscle contraction. Generally, sympathetic nervous system, especially adrenaline, increase the cyclic AMP levels on the heart and increase the heart rate. But here, parasympathetic nervous system, acetylcholine, opposite to the adrenaline, sympathetic nervous system. So what is happening here? Negative chronotropic action, as well as inotropic action, as well as dromotropic action. So negative means decreasing. What is decreasing? Chronotropic means number of beats are decreasing. Chrono means sounds. Number of beats are decreasing. Negative inotropic means number of contractions are decreasing. Dromotropic. Negative dromotropic means conduction velocity of heart is reducing. In case of sympathetic adrenaline, positive chronotropic, contractions increases, positive inotropic, positive chronotropic means number of beats increases, positive inotropic means number of contraction increases, positive dromotropic means conduction velocity increases. That is regarding adrenaline, sympathetic nervous system. But here it is parasympathetic nervous system, acetylcholine, negative chronotropic, decreased number of beats, negative inotropic, decreased number of contraction, negative dromotropic, decreased conduction velocity of the heart, myocardium. Next is regarding the M3 receptors. Next is regarding M3, type 3 muscarinic receptors. The location on the smooth muscle. The smooth muscles like bronchioles, lungs, eye, GIT, gastrointestinal tract, genitals, urinary bladder, as well as blood vessel. So all these are the smooth muscles. On all these smooth muscle, parasympathetic innervation through the M3 muscarinic type 3 receptors. And here on the glands like salivary glands, as well as lacrimal glands, as well as bronchial secretions, as well as gastric glands, as well as sweat glands. So on the smooth muscle, as well as all type of glands, there is innervation of parasympathetic nervous system with help of muscarinic type 3 receptors. Regarding the signal transduction, G alpha Q, that is DAG IP3, diacylglycerol as well as IP3. So the cyclic KMP, that is cyclic adenosine monophosphate, DAG, diacylglycerol, IP3, inositol triphosphate. These are the secondary messengers important for the generation of a pharmacological action. So here the signal transduction is G alpha Q, that is DAG or IP3 pathway. Regarding the function, all smooth muscle produces contraction when there is a acetylcholine is binds to the receptors, exception blood vessels. So all smooth muscles contraction, but exception is the blood vessel. Blood vessel is also a smooth muscle. But why? Because vasodilation is caused by endothelium derived relaxing factor nitric oxide. So on all smooth muscle, acetylcholine contraction, but blood vessel smooth muscle relaxation, because when acetylcholine interacting with the blood vessel M3 receptor, there is a release of nitric oxide, which is called as potent vasodilator in the body. It is also called as endothelium derived relaxing factors. Okay, this is the function of M3 acetylcholine on the smooth muscle. Next, glands. On glands, always acetylcholine increases secretion. Acetylcholine increase the lacrimal secretion, increase the salivary secretions, increase the bronchial mucus secretion, increase the gastric acidic secretion, as well as increase the sweat secretion from the sweat glands. Next, regarding M4, type 4 muscarinic receptors. Next is type 4 muscarinic receptors. Both type 4, type 5 muscarinic receptors are present in the CNS, central nervous system. But the signal transduction of M4 is the G alpha IR naught, decreased adenyl cyclase as well as cyclic adenosine monophosphate. But the signal transduction of the M5 receptor is G alpha Q, increased diacylglycerol or inositol triphosphate action. And regarding function of M4 receptors in the CNS, enhanced locomotion means our movements like hand movement, like leg movement, body movements, all movements are under control of M4 receptors. And regarding M4 receptors, M5 receptors in the CNS, modulates the dopamine neurotransmission in the CNS, modulate the dopamine neurotransmission in the CNS. So it is a parasympathetic, but it modulating dopamine action with help of M5 receptors in the central nervous system. So modulation means it may be positive modulation, negative modulation. Positive means may increase the dopamine action, negative means may decrease the dopamine action based on the body requirement, based on the body demand. Modulation, it will simply modulate the situation based on the body condition. So this is regarding the muscarinic receptors. 5 types of muscarinic receptors comes under the parasympathetic. All are G protein coupled receptors and the neurotransmitter is acetylcholine, and the antagonist of acetylcholine is atropine. The atropine is a muscarinic receptor blocker. Here again I am repeating, regarding the signal transduction, if you want clarity, please go through our receptor pharmacology videos in our channel. Okay, thank you.